Welcome to Symptoms and Side Effects of GIST, what they are and what to do. Please remember that information provided in this web seminar is not intended as a substitute for your physician's guidance and care. My name is Sarah Rothschild. I'm the VP of Program Services, and I am your moderator for today. I would like to introduce you to two of our presenters. First up is Dr. Lori Williams. She's an associate professor in the Department of Symptom Research at the University of Texas MD Anderson Cancer Center and an advanced oncology certified nurse. She has worked in oncology nursing for more than 35 years. She's a member of the executive board of the Patient Advocate and National Patient Advocate Foundations and the secretary-treasurer of the board of the Oncology Nursing Certification Corporation. Her current work at MD Anderson involves the study of symptoms of cancer and cancer treatment, and she's currently working with leadership at MD Anderson to institute routine clinical symptom monitoring for all patients. Pete Knox is our Senior Director of Research at the LifeRaft Group, and he's a key member of the real-world evidence team, utilizing his analytical skills to provide strategic oversight of the LifeRaft Group's research and data platforms. In this role, he identifies and develops potential collaborations with institutions and organizations that utilize data to advance research with the goal of improving overall survival and quality of life for GIST patients. I hope you're in for a real treat today, and I would like for Dr. Lori Williams to please begin.
Well, hello, everyone. It's very nice to be with you today. And I'm going to talk about the symptoms and side effects of GIST and what they are and what to do. And some of what I will be telling you today comes from a study that we did here at MD Anderson. This was the study team for that study, and it was supported by a grant from Novartis. So first of all, we're going to talk about what symptoms are and what they aren't. Symptoms are the subjective reports by patients of a change in normal functioning, sensation, or appearance due to disease or treatment. And in our current healthcare world, these symptoms now are often measured by things that we call patient-reported outcomes, or PROs. Those are questionnaires. Because they are subjective, they can be known only from the patient. So that's why we have to get that information that way. The other things that can be experienced due to disease or treatment are side effects. Those are abnormal functions that result from the disease or treatment, and they can be noted and reported by healthcare providers or others. So those are things that people can know without asking the patient. Those are things like lab values from a lab test or images from a scan. So those things can be known without the patient directly reporting them. We also talk about symptom burden, and this is the combined impact of the disease and treatment-related symptoms on the ability of individuals to function as they did prior to the onset of illness. This is why it's important for us to know about symptoms and to try to do something about them to decrease this burden. So what we did here at MD Anderson to find out something about the symptoms of GIST, because there wasn't really a lot known, we actually developed a specific questionnaire about the symptoms of GIST. And in order to be sure that we were getting the right things, the right symptoms, we first interviewed 20 patients here at MD Anderson who had GIST. And we asked them about what symptoms they had when they first got sick, before they may even have known what their disease was. And then we asked them what symptoms they'd had during various treatments they'd had. And this way we developed a list of symptoms related to GIST and its treatments. And then from that, we took that list, which was between 40 and 50 symptoms, and we asked a group of experts that included physicians who were caring for the patients with GIST, nurses, pharmacists, advanced practice providers, other people involved in the care of the patients with GIST. We asked patients, and we asked some of the patient's family members which of this total list of 40 to 50 symptoms did they really think were the most relevant to patients with GIST. And from that, we got that list down to what we felt was something manageable that people could respond to. And then we asked 150 patients who had GIST every 1 or 2 weeks for a year to fill out the questionnaire. And this questionnaire measured the symptom burden of GIST and its treatment. It measured the severity of the symptoms that we had found were considered the most relevant to GIST, and the interference that these symptoms had with daily functioning. And here is, you can see in this slide, a picture of what the questionnaire looked like. And so it asked 20 different symptoms that were rated on a scale of 0 to 10, where 0 meant the symptom wasn't present, and 10, it was as bad as the patient could ever imagine the symptom being, to rate the symptom at its worst in the last 24 hours. And then we asked 6 additional questions as to how these symptoms had interfered with some very general activities of daily life, with mood, relations with other people, work, enjoyment of life, things like that. So that gave us quite a lot of data. And from this, we found that overall, the symptoms that patients with GIST reported as being consistently most severe were fatigue, drowsiness, general weakness, disturbed sleep, and muscle soreness or cramping. So those were the 5 that had the highest severity. So were all the patients in our sample the same, though? Well, no, they weren't. We had an age range. It went from 20 to 90. So we had a big age range, but the average age was 60. We had about half males, half females. 3/4 of the patients were married, and not quite 50% were still working, and most of those that were working full-time. When we looked at their disease, 55% had started in the stomach, 34% in the small intestine, and then the rest of it in a variety of places. And 66% of these patients did have a KIT mutation. The time from diagnosis of this group of patients ranged from 1 month, so some were really early in their disease and were just having symptoms from when we started measuring, from the disease itself. Of course, over the course of a year, they started treatment, and then they started to have treatment symptoms too, all the way to 19 years. So we had patients who'd had the disease for a long time. But the average was 3.5 years since diagnosis. 75% were on a kinase inhibitor, and of those, 51% were on imatinib. And then the others were on a variety of kinase inhibitors, including both those that were considered standard of care after imatinib failure, and also there were some investigational drugs. 48% had had a kinase inhibitor before also. And this was, I think, very interesting for us to understand. Were everybody's symptoms the same? No, they were not. We used a specific statistical technique called trajectory analysis, where the computer took all of the symptoms over the course of the year. So this shows over the course of the year. The computer takes each patient's symptoms and then decides, was that patient, were their symptoms in a low group, or were they reporting symptoms in a high group? And we saw that it did divide out, and it was about 2/3 who were in this low group. And this low group, they were reporting symptoms that were in the range of 1 to 2. That's on a 0 to 10 scale. Symptoms at a 1 to 2 level are very low-level symptoms. Some days they were probably not really, they were feeling pretty good, not having any symptoms at all. And other days they might have had a little fatigue, a little nausea, but not much. Then there was a second group, though, where on an average they were reporting symptoms at about a level of 4. And that's where we start thinking that symptoms are at a more moderate level. So for these patients in this group up here, they were really having probably a significant symptom burden. It was making a difference in their lives, and they were having it consistently across the whole year. So it wasn't like they had it for a little while and it went away. These people were having a lot of symptoms pretty consistently. So these are the group that we really are concerned about, that we would really like to be able to do something about. So who ended up in that higher group? In general, younger patients ended up in that higher group. Patients who were on therapies other than imatinib ended up in that group. So imatinib was pretty well tolerated, but if they had to switch to a different treatment, that was when they started having more symptoms. And finally, for some reason that we don't particularly understand, but those who had GIST that started in their stomach also tended to end up in that group. So what were the symptoms and side effects from GIST? Now, the way we kind of separated this out was we asked patients, when we talked, that first group of patients that we had, the 20 that we interviewed, we asked them, what were the symptoms you were having when you were first diagnosed? What did you notice? What took you to the doctor? And so we figured that those were the symptoms that were due strictly to the disease, because they hadn't had any treatment yet. Then we asked them, for the various treatments that they had had, what were the symptoms that they had while they were on treatment. And if they had a symptom that developed that they hadn't had before they started the treatment, we figured that was definitely a treatment symptom. If a symptom that they'd had at first got worse during treatment, but their disease was responding to the treatment, we figured that was a symptom related to the treatment. And if there was a symptom that got better on the treatment while their disease was getting better, we also figured that was a disease symptom. So the symptoms that we found that we think were from GIST were pain in the abdomen, nausea, vomiting, bleeding from the GI tract that the patients were noticing, fatigue, distress, constipation, and difficulty swallowing for some patients. The side effects, so the things that the doctors could tell, were low hemoglobin and a mass in the abdomen. Those were the things that kind of were present when the disease was first diagnosed. So then, what were the symptoms and side effects that patients reported to us that they had when they had surgery for their GIST, if they had surgery? And these included pain, fatigue, nausea, vomiting, constipation, distress, lack of appetite, and disturbed sleep. The side effects were sometimes an infection, a low hemoglobin, and blood clots sometimes occurred with surgery. So then what were the symptoms and side effects that patients reported when they were on imatinib? Again, these included fatigue. There were some patients, not all, but some, who said their fatigue got worse on imatinib. There was nausea and diarrhea. There were muscle aches or cramping, sometimes a rash, and sometimes they noticed mild levels of bleeding. This usually wasn't anything severe, but they would notice maybe nosebleeds, things like that, or they bruised more easily. The side effects that happened with imatinib sometimes were elevated liver function tests. These were usually mild elevations. Sometimes they developed fluid around the heart or in the lungs. They sometimes had low blood counts. They sometimes had infections, abnormal blood tests from either liver or kidney damage, weight loss, high blood sugar, or a low blood calcium. One of the other treatments that quite a few of the patients in the study had was sunitinib. So we looked at what were the side effects that patients were reporting if they were on sunitinib. and these included fatigue, diarrhea, nausea, vomiting, sore mouth, lack of appetite, bleeding, rash or other skin changes, muscle soreness or cramping, or headache. So these were similar to the side effects of imatinib. There are a few more, and these seem to be a little more severe with the sunitinib. The side effects that these patients had were low white blood cell counts, infection, fever, low platelet count, sometimes high blood pressure, abnormal blood tests from liver, kidney, or pancreatic damage, heart problems, liver or kidney failure, blood clots, abnormal thyroid levels, and sometimes damage to the jawbone. So again, there were more symptoms here than there had been, or more side effects here, than were with the imatinib. Regorafenib was the other drug that there were quite a few patients who were on, and again, this was one of the ones that had FDA approval for treatment of GIST. And the symptoms with it, again, fatigue, lack of appetite, sore mouth or throat, diarrhea, rash or skin pain, bleeding, hoarseness, headache, change in taste, and muscle aches or cramping. So again, some of these symptoms are very similar, and then each of the drugs seems to have a couple of unique symptoms. For side effects, patients on regorafenib sometimes had weight loss, infection, again, as with sunitinib, high blood pressure, low white cell or platelet counts, infection, abnormal lab tests from liver or kidney damage. They sometimes had low thyroid levels, severe liver damage. A few of these people had heart attacks, and sometimes they developed a hole, a perforation in their stomach or intestine. So, what to do about these symptoms, though? What to do if you have GIST and you're on treatment? What can you do about this? First of all, if something bothers you, let your doctor or nurse know. Don't feel like it's not important enough to tell somebody, because people can't do anything unless they know about it. And again, if you all of a sudden develop a very severe symptom, sometimes you will need to actually go to an emergency room or call 911. Other symptoms, if they are bothering you but they're not life-threatening, you can wait until regular business hours and contact your clinic, or you can mention it at a visit. So that's about when you should let your doctor or nurse know. And what is causing the symptom? We have a little indication of whether it might be the disease or treatment, but we don't always know. And so it's important, once you let your doctor or nurse know that you're having a symptom, they often will ask you more questions, and that may help them pinpoint what the cause of the symptom is. So sometimes patients are a little reluctant to report symptoms. I hear this because they kind of think, oh, what if it means that the disease is getting worse? I don't want to report it. Or what if they'll stop my treatment if I say, the treatment is, one of the symptoms is due to the treatment and it's severe. It's always important to let somebody know and let them make an informed decision about what to do about it. Just reporting a symptom doesn't necessarily mean that that symptom means that your disease is getting worse. It could be from something else, nor does it mean that they are going to stop your treatment. There may be other things that can be done. What can you do for yourself if you have been given medication for a symptom? For instance, for nausea, if you start to have nausea, or for pain, if you start to have pain, go ahead and take your medication. Don't be afraid to take it. Don't sit around and say, well, gee, I don't know if it's bad enough if I should take it yet. It's usually better with symptoms, if you're given a medication to treat it, that you get on top of it early rather than waiting. And if something has worked for you in the past when you've had a symptom like that, go ahead and try it, as long as it's not something that your doctor or nurse have told you not to do. But if you have something that has worked for you in the past, go ahead and try that. So what should you do for some specific symptoms? I'm going to just cover here some of the most common ones that we know happen with GIST and its treatment. For fatigue, the thing that we know that can help fatigue the most, and we actually have research on this and we have good evidence for it, is exercise. And I know it sounds counterintuitive because if you're feeling really fatigued, you're like, well, I'm too tired to exercise. I actually think what is best for patients is if they knew this ahead of time, and I wish we were better about relaying this to patients, is start a mild exercise program before you start treatment, because that may help you to keep that fatigue at a manageable level. If you have become fatigued, however, again, starting a very mild exercise program and gradually building up can sometimes help. And so, for instance, sometimes it's not anything more, if you're extremely fatigued, than just getting up and walking around the house every hour rather than sitting all day. And gradually then increase that, and then maybe try, just a little walk outside, but just keep gradually increasing. You can also ask, if you're having severe fatigue, sometimes that also may need to be evaluated medically, because there are lots of things that can cause fatigue. And just because you have GIST and are being treated, you could have another problem too. For instance, the regorafenib, I think it's the regorafenib, can cause a low thyroid hormone level, and that can make you fatigued. So there sometimes needs to be further workup. So it's also important to mention this to your physician or your nurse. And then sometimes also, if you're really fatigued, you can even be given a prescription for rehabilitative physical therapy to help you gradually build back up. Activity management also, if you're fatigued, do the things that are important to you, and you can, look at your schedule and don't do things that are going to wear you out so that you don't have the energy to do what you really want to do. Again, maintaining a healthy diet. Be sure you're getting enough protein, enough carbohydrates. That can help with fatigue. With pain, including headache, take your medication as appropriate. Ask your doctor if over-the-counter pain medicines are okay to take, because some are and some aren't. There are some of them that when you're at risk of bleeding, they don't want you taking, and there's always a danger with medications that you can get drug-drug interactions. So always check with your doctor, but if there's something over the counter that has worked for you in the past, ask your doctor or your nurse if it's okay to take that for pain. But be sure you let your doctor or nurse know that you're having pain so that they can be sure that's adequately managed. Nausea and vomiting, again, medications often help with this. And if you're vomiting, or if you're nauseated and really not wanting to eat or drink, you still need to be sure that you're getting enough fluid and electrolytes. Taking small amounts of fairly bland food and cold food also can be easier on your stomach than trying to eat a large meal or hot foods. Often with nausea, cold foods that don't have as many odors associated with them are better. And ginger or ginger ale also helps a lot of people, so that's something to consider. You can get ginger candies. If you have a lack of appetite, again, the frequent small amounts of food are better than large meals. And just, having a small plate with just a little bit on it is better than having a big plate of food, even if you say, I'm only going to eat a few bites. Just seeing that big plate of food often takes away your appetite. Eat foods that sound good to you. At this point, if you're just not eating much at all, forget about the balanced diet. If peanut M&Ms sound good, eat peanut M&Ms. They have protein with the peanuts, and they have calories with the chocolate and candy coating. So eat whatever sounds good so that at least you're getting something in. Concentrate on calories and proteins. And when you're drinking liquids, again, you need to drink liquids, but sips of liquids that have calories are better than water at that point, because the water may fill you up and then you won't get any calories. So that's a good thing to remember if you have a lack of appetite. If you have a sore mouth or sore throat, mixing a little bit of table salt or baking soda in a glass of water, just a small amount, and then rinsing your mouth will often help. Be careful if you're using topical anesthetics in your mouth, because if you swallow them, they can eliminate your gag reflex and you may choke on something, so you need to be careful with that. Again, with a sore mouth or throat, avoid spicy or rough foods, because that will cause more irritation. And cold foods, popsicles, things like that may be soothing. And if it's very severe, you may even need pain medication for a sore mouth or throat. Diarrhea, take medication as prescribed. Check with your doctor or nurse if you get diarrhea before you take anything over the counter. But once you have their approval, there's quite a few over-the-counter medications for diarrhea that work pretty well. And then take them as soon as you have diarrhea. Take the medication so that maybe you won't have any more. You can get it on top of it. Spicy foods and fibrous foods also are bad for diarrhea. They will cause more, so avoid them. And actually, if you're having a lot of diarrhea, a diet that works really, really well is what's called the brat diet, which is a diet of bananas, rice, apple juice or apple sauce, and toast. And that will often, because it's so bland, will help stop the diarrhea. For muscle aches and cramping, sometimes massage and rubbing helps, sometimes heat helps. Stretching can help, gentle walking, and then if it's really bad, pain medication. If you're having a rash, be careful about putting anything on it before checking with your doctor. Avoid very hot water, like very hot showers, and the sun. Keep your skin clean and dry. If it's itching, don't scratch it. You can pat it, but don't scratch it where you might break the skin. And medication can be prescribed for itching if it's severe, or your doctor or nurse can tell you can get some, maybe Benadryl over the counter and take it, but again, check. If you have bleeding, if it's like anywhere where you could get to it, obviously if you vomit or have diarrhea and notice blood, you're going to let your doctor or nurse know. But if you have a nosebleed, for instance, apply constant pressure for a long time. Don't keep taking the pressure off and checking. But for a nosebleed, for instance, push that side of your nose firmly and consistently for at least 10 minutes. That will give you the best chance of getting it stopped. If you're having bleeding, you would definitely want to avoid aspirin or things like Aleve or Advil that are over the counter, because that can cause more bleeding. And you should also be very careful if you're prone to bleeding. For instance, say you have the side effect of a low platelet count. Be very careful with knives, razors, and even stiff toothbrushes, because they can cause bleeding in your mouth. So what to do now for the side effects, not the symptoms, but the side effects. Your doctor really will let you know, because he'll let you know, he or she, your doctor or nurse, will let you know that you have the side effects, such as elevated liver enzymes. They may have you do home blood pressure monitoring. If your white blood count is low, they will tell you to wash your hands often, and this is critical. And then to avoid crowds and people who have infections. So during the times your white blood count is low, you would stay home. And watch for signs of infection. If you get a fever, your doctor or nurse will let you know when they want you to call them if you have a fever, but usually it's over 100 is when you should let them know. Maintain good dental hygiene and have regular dental checkups but you need to be careful if you have a low white blood count about flossing. So they may not want you to floss during that time. They may tell you to watch for yellowing of your skin or eyes if you have elevated liver enzymes, because that would indicate it might be getting worse. And they may tell you to watch for excessive thirst or urination if medication has caused you to have high blood sugar, because that thirst and excessive urination are symptoms of that. So they may tell you to watch for that. And that finishes my part of the presentation for today. So I'll turn it back to you, Sarah, for a minute.
Thank you, Lori. We really enjoyed the presentation. I did have some questions come in, but we're gonna wait to the end to ask them. Right now, I'd like to have Pete begin his presentation on SIDEQ.
Thank you very much, Sarah, and thank you, Dr. Williams. That was an inspirational presentation, and I say inspirational. Obviously, Dr. Williams is inspirational. I've met her. I can confirm that. But it also literally inspired what you're about to see, SIDEQ, in many ways, because a lot of the work she's been doing for years on side effect management, we wanted to kind of put it into action and see what we could do to help just patients, and then you'll see patients of other cancers enter this information and what we could learn from it. Now, I will point out, when Dr. Williams talks about symptoms versus side effects, okay, this is SIDEQ, that's what we're calling it, but the reality is it's really collecting symptoms, okay? It's not collecting things that you need to go to a doctor to find out about, elevated liver enzymes or anemia. It's collecting things like diarrhea, fatigue, things that patients can report. That's based on feedback from the FDA, which we'll go to in a minute. And if you just look at the title of this slide, you'll see that it refers to personalized side effect management, and that's really the goal of this system. And just to briefly explain what that is, and if you want more detail on personalized side effect management, I'll alert you to our upcoming newsletter where I have an article that goes into a lot of detail on it. But there was a question or a statement that Dr. Williams made that said, was everybody suffering the same side effects? And the answer was no. We're not surprised by that, because our registry has shown us that for years that that's the case. The question we were looking to ask was, what is it about those people that are experiencing a side effect or not experiencing, or experiencing a different side effect? What type of characteristics do they have, and can we learn from that and be somewhat predictive to give more specific or personalized side effect management advice? So when we talk about SIDEQ, okay, just to give you a brief detail, and here you can see where it's available at mysideq.org. This was designed originally with just patients in mind, but we extended it out to other cancers as well. The scope is all cancers. And what this does, there are actually two sides to the site. One is a kind of diary function that allows users to track their disease, medications, side effects, and quality of life issues. I'll show you that in a moment. But also there's another side to it where you heard Dr. Williams talk about tips, where patients can give tips and experts can give tips as well. So the thought with that was, we'll give you that right now while we're still collaborating on research and trying to figure out what we can learn. We didn't want you to have to wait for that. It's on the web, as I said, mysideq.org, and there's already over 450 users. We've been out for a little over 2 years. And like I said, it's beyond GIST. There's 40 different diseases and about 60 different medications represented, including the big ones approved for GIST and some immunotherapy medications as well. I mentioned that when we did this, we designed this with feedback from the FDA, and I will show you a question that they actually provided for us. And we did this because it was based on, to be technical, the pro-CTC-AE lining of side effects and symptoms, which was something that the FDA was behind. So we wanted to get them involved from the very beginning. Okay. So some of these questions Dr. Williams also kind of referred to when we ask ourselves, the side effects, or in our case symptoms really, affect quality of life issues. Key for us is compliance, which is defined as your ability to take your drug as prescribed. Are there certain side effects that certain patients are concerned about more than others? That's the question the FDA wanted us to answer. And then also, these side effects, do they vary based on certain demographic characteristics? So the suffering of side effects, is it in fact personalized, is really the question. Now, let me just go here, and I'm going to go to the web. Just give me a second. Right there, and share, and I will take you to Sarah's email, and then SIDEQ. So this is the SIDEQ site. Okay, now what's funny is this is the home page you'll get on when you first log on if you create an account. you'll notice you've heard these before because a lot of these side effects are ones that Dr. Williams mentioned. Interestingly enough, she kept talking about fatigue, diarrhea, muscle cramps, and it was very hard for me to not mention that the 3 side effects we've noticed are most common among GIST patients are fatigue, diarrhea, and muscle cramps, and they often compete as to which one's 1, 2, or 3, but that's consistent with what she's seen. I'll get back to this in a minute because it talks about the tips, but what I want to show you is the profile. Okay, so if I go here and a user would go to their profile, you'll see some of the demographic characteristics that we track. So patients and caregivers can use this site, so caregivers can enter on behalf of the patient. We're capturing gender, it's male, female, or you can choose not to specify. The month and year of birth, so we can get an idea of age, and then the country of birth, which kind of speaks towards ethnicity. The idea is to look at these particular characteristics and see whether side effects vary among these populations. We also collect disease information. Now, this is test data, so you're going to see a lot of interesting data in here. But, here's a GIST patient, and the medication they take is key to their GIST. Okay, so if you want to add a new medication, and you'll see we have some of the most common medications on here, including GIST and kidney cancer and LMS, and also some of the most common medications. Now, you're not limited simply to those. You'll see some of the new immunotherapy drugs are on there because patients are already using them. But you can always select either no medication or all, or a different medication, which gives you access to a much bigger list. And the same is true with diseases as well. Okay, so after you've included medication and side effects, let me just click. She's trying that one. Okay. Let me show you also the side effects themselves. So once you've done the registration process, you've supplied your disease, you've supplied your medication, you can add additional ones later. But down here on the bottom, you're going to see a listing of side effects. And we allow the patient to opt in and say, I'm actually suffering with this particular side effect currently. Okay? That's going to be very important in a moment when I show you how to rate them, because you have to actually select that you are suffering from these side effects. If you're not, there's no point in having you rate them. So if you go up to the top here, and this is actually accessible from any screen on the site, we ask you to rate your side effects. Now, this is where, and this was inspired, especially the quality of life I'm about to show you, by the MD ASI GIST questionnaire that Dr. Williams showed you. We had to differentiate it a little bit in that instead of 24 hours, we had to make it 7 days because the pro-CTC-AE side effects are on a 7-day schedule. And a lot of data in here, but you'll notice that there are ones that have to do with severity, so they ask you about your severity. There are ones that have to do with frequency, so how often is this happening? And then there are also ones that just basically are yes or no. And this is consistent with how pro-CTC-AE and the National Cancer Institute and the FDA do this. Notice this last question, though. Which one of your side effects concerns you the most? The FDA wanted us to add that. You would think that side effects that are rated higher would concern people the most, but that's not really true because it ties to other issues. If you are a younger female who's maybe out there dating and you have a rash, that may actually be worse for you. You may have concerns about that more so than your headache or your watery eyes, even though one of them may be more severe. It's allowing the patient to give their perspective onto what concerns them the most. And we'll show you some data about that in a moment. Quality of life, again, this is not just saying, it's very similar to what Dr. Williams mentioned, are you having these issues, but are these issues related to the side effects you've just reported? And one that's very key to us is your ability to take all of your medication as prescribed, referred to as either compliance or adherence, because we wanted to know, were these side effects or symptoms affecting a patient's ability to take their medication, because our thoughts were, if that happens and we're not allowing the medication to work, it's going to lead to a less desirable outcome, which is not what we wanted. So we wanted to be able to measure that. Before I go back to the data, let me show you the other side of the site, as we say. And actually, let me show you something else. So you've rated your side effects, let's say. You have something called a dashboard. So let's go here, and these are only the ones that you have selected. Okay, let's take a look at fatigue. And you will see you're allowed to look at the rest of the site and say, all right, among those who have experienced fatigue, 55%, roughly 56% are female, this percent is unspecified, this percent is male. You could look at that and see where you fall in. The same is true by age, by disease, okay, and by drug. This is a form of personalized side effect management. You can see already that more patients on this drug see this side effect, or more patients in this age group, so we're starting to get to that. But what's really key, and I think gives back to the patient right away, is this idea of ratings over time. So the idea is not just to enter your side effects, but to keep entering them. So take a look at this and imagine, now this is fatigue, and again, it's test data, but it's pretty indicative of what really happens. This patient was experiencing severe fatigue, then the next day very severe, then severe again, then back down to severe, and then now it's getting down to moderate. So what? Well, imagine you're that patient and you're looking at that and you're saying, wow, my fatigue went down. Well, maybe you had listened to Dr. Williams' webcast and you had decided at that point to start exercising or to start eating more vegetables or something else, and you noticed that this went down. So that's a way of being able to look at events that changed in your life and being able to figure out if there's an effect. So there's a diary effect. We are, at the LifeRef Group, on an aggregate looking at that and seeing, let's chart and see whether or not these ratings went down, and if so, if we can figure out reasons why it happened. The same is true of quality of life. I'll just show you, for example, here's the compliance issue. And again, this is test data, so don't draw any conclusions, but this patient wasn't having any problems with compliance, and then they did. I'm going to just tell you, because it's test data, it's not related to the fatigue going down, but if it weren't test data, we could look at that. So let me just go back. Actually, let me show you the side effects hub. This is the home page we mentioned before, and I want to show you one particular side effect, fatigue, which we all talked about. Now look at that. You'd almost think we planned that, and we did. This particular expert tip was given us by the aforementioned Dr. Williams, and if you read it, you'll see that it gives you a lot of tips as to how to deal with fatigue. Right up there's exercise and sleep and all the things that she mentioned, ginseng and all that other stuff. It also tells you what you should do. I feel like we kind of stole the thunder for a slide here. I'm glad she went first. And also resources. Now, not all of them are this elaborate, but we do have, for every one of these side effects, tips like this. Now, this is the expert tip, and you'll also see underneath that there are posts that come from patients, and caregivers, and they can ask questions themselves. So this is something where you can immediately interact with other people on the site and ask them, hey, has this worked for you? The classic one is, I have nausea, I've been taking dark chocolate, well, what do you think about that? Okay, and I will also mention, and it's all over the site, that this is not recommended as a replacement for talking to your doctor. Obviously, no one would recommend dark chocolate to a diabetes patient, so that's just something. You look at this and you have to take this information to your physician. But this gives you an idea of what you're seeing on a tip level. And again, there are 20 tips, and we're looking to add more. Okay, this here little window that's popping up is a reminder to the patient that you haven't changed your ratings in 7 days. So there's a little incentive to do that. So again, looking at these, you can see. Let me just go back and show you some of the data we've managed to pull out. So we talked about what key questions it can address. Now, one of the things we talked about was compliance, and is it affected by side effects? Well, it turns out it is. So if you look at this, you'll see, again, the same question. In the last 7 days, how much have your side effects interfered with your ability to take all your medications prescribed? Now, 64% of people are saying they're not, but that means that 36% are saying they are. So, and some of them are saying that it's happening quite a bit. So for 36% of patients, and we can update this data as we go, that is an issue. So we've already documented that fact, and we also have emails for all these patients. And remember, this is beyond GIST, so we could reach out to them and say, would you like to participate in a further, more elaborate survey so we can understand why that is. So that's one thing we're looking at. And then I also talked about, well, these side effects, in fact, vary over some of these different characteristics, okay? Gender, age, ethnicity. We're just beginning to get this data. So I'm going to show you some small amount of data, but if you look, you'll see already. This is not, do you experience this? This is, what's the side effect that concerns you the most, the FDA question. If you look here, you'll see the blue is female, the orange is male, and the gray is unspecified. And you can see in a lot of cases, there are issues that females report being more of a concern, and then there are some issues that males report being more of a concern. So we're already seeing, again, in a very small subset, a differentiation in gender among side effects that are concerning. Okay, we're going to follow that and see if that's the case. Okay, we can also look and see, are you experiencing that side effect at all? So are males more likely to experience nausea or fatigue, or are females more likely to experience muscle cramps or diarrhea or joint pain? So we're in the process of looking at that. And the last thing I want to mention, or in terms of data, is because this is a website, we have the advantage of it being global. So you saw the country of ethnicity, all right? So if you look at this, you're going to see, and this is very hard to read, but don't worry, we'll fix that in a moment. Most of our patients are from the United States. But there are patients from countries other than the U.S. There are actually, at the time of looking at this, 64 users from other countries. Let me just go here and show you, this is for non-U.S. You'll see a number of Canadian patients, patients born in the U.K., Denmark, and a bunch of other countries. The thought here is we're going to look and see if there are ethnic concerns, because what we're really looking to do here, and I should probably jump to the next slide to mention that, is our goal is to be able to give information to a physician where they can go to a patient, as opposed to looking at the prescribing information from a clinical trial and saying 30% or more of patients experience fatigue, diarrhea, and muscle cramps. We want to actually get to a point where you're talking to one patient who happens to be an Asian female between the ages of 25 and 34, and be able to say, well, actually, these are the side effects you should be concerned about with those characteristics. And then another patient who might be an African-American male who's 72 years old and maybe is a former smoker or a current smoker. And we want to look at that and say, we're going to give you actually personalized side effect management, because everybody looks at these PIs or these commercials and says, is that really going to happen to me? Is that what I'm really going to suffer with? We're trying to get to that point. So what are we doing? The next steps, obviously, we're going to continue to collect data from what we have, okay? And we're also interested, and please, if you have additional things you're talking about that you're interested in, let us know. We want to know, are there other characteristics that we could look at? And I'll mention that we also collect dosage in addition to drugs, so that's one thing we could look at. But our next step, and we're in the middle of doing this now, is we're going to integrate this with the patient registry. So you may have heard Dr. Williams refer to certain mutations or certain tumor locations and things like that. The thought is, obviously, for just patients at this point, we're going to integrate this SiteEQ data with our registry data. So now we can see that maybe not only is that male patient more likely to experience fatigue, but that's especially true if he's an exon 9. And even go further, he's an exon 11 high deletion, okay? Or he's taking imatinib for more than 4 years as opposed to 4 months. So that's the thought going forward. And what I ask of you is, if you, and I've said this before, if you're on SiteEQ, thank you very much. Continue to update your data. If you're not on SiteEQ, please consider doing so, because you're helping not only all the other patients out there, but you're helping yourself, because it has this diary function that should allow you to help manage your side effects better. And that's basically what this slide says at the end, is thank you to the patients, because without them, we would have nothing. Sarah, back to you.
Thank you so much, Pete. I hope for those on the line that you've gained a new understanding of this platform. And at this moment in time, we are going to open it up to questions. So the first question is for Lori. I'm on imatinib. My worst symptom is very fragile, tender skin. Just a tiny scratch or nick will burn like fire, turn blood red, and take a long time to heal. Plus, I bruise so easily. Just a tiny bump, and I'll bleed through clothing. What can I do to strengthen my skin? I'm taking lots of vitamins and supplements, including biotin.
In terms of, there really is not much you can do to strengthen skin. Imatinib does tend to cause a lot of skin changes. What you're having is not one of the more common, but it certainly can. It would be really important to keep your skin moisturized and not let it get dry. And so what you probably want to use on it, though, is some kind of just a very mild moisturizer. Eucerin cream is one that I know is mild and is a good moisturizer. There certainly are others, though. And you definitely would want to, as I mentioned earlier, you're going to want to avoid really hot water. You're going to want to protect your skin in the sun, so you're going to want, when you're outside, you're going to want to wear clothing that covers your skin as much as possible, and use sunscreen on areas that you can't keep covered, because your skin is going to be much more prone to burning, to getting sunburn, I think. That's what I would guess. And while it certainly is important to have good hygiene, and stuff, you're going to want to, avoid washing your skin too much either. So while you need to wash your hands frequently, you may want to do more targeted bathing, maybe every other day instead of everywhere, again, because that removes oils from your skin and will make it drier and thinner. And then when you use a very mild soap on your skin, don't use anything harsh. And if it's really severe, you may, be sure you mention it to your doctor or nurse, and they possibly could even send you to a dermatologist for more consideration if they thought that was necessary. And it would probably be a good idea to go to a dermatologist anyway if you don't already do this for a yearly skin check to be sure there's nothing on your skin that looks like a skin cancer also, which can develop in very sensitive skin. It's not common that, I have very pale skin, and so I go every year and get my skin checked just to be sure that there's nothing on there that looks unusual. But I think moisturizing your skin would be the most important, and then, of course, you want to avoid bumping as much as possible.
Okay, thank you very much. The next question, this person is on Gleevec, and he says, I've lost my taste. Foods do not taste the same. They're all bland. Is this a side effect that other people get?
Again, it's not common. It's not one of the common ones, but because Gleevec, we know, causes interference with the gastrointestinal tract, it can affect taste. I don't know if you notice that you have less saliva than usual. Sometimes if you get less saliva, that also will affect your taste. And so it's not common, but the Gleevec definitely could do that.
Okay, great. Thank you. The next question, this is for Lori as well. Do we have any observations and evidence about different side effects of brand Gleevec versus generic imatinib?
It's interesting that you should ask that because I actually have a study going on, not in patients with GIST, but in patients with chronic myeloid leukemia, where we are trying to track if there are any differences. We started it when the generic imatinib became available, and we thought that insurance companies would immediately start making people switch, but it took about a year or two before there was a lot of switching. So far, we have not really been able to pick up any significant changes in symptoms between the two with the patients that we've been following. We've learned a lot from these patients about how they feel about switching and things like that, but we have not, in terms of symptoms, we haven't seen a lot of difference.
I'll just add to that in terms of the patient registry, we've been on top of that as well, and we've had very similar findings where there really hasn't been much of a difference. There's some, but I will also point out that realize nobody has been on generic for more than 3 or so years. Okay, so we do know that side effects often change over time. So it will be very interesting to see going forward for patients who've been on generic imatinib for longer periods of time if that continues, if their side effects change similarly to what happens with name brand Gleevec or if they're different. And we actually, inside EQ, we differentiate when it comes to medication between generic imatinib and Gleevec for that reason.
Okay, great. Thank you. There's also a question about will side effects increase with extended time on imatinib, and I guess that relates to what you're saying.
It depends. Actually, in many cases, we've seen the reverse, where what happens is side effects initially are bad and tend to get better. However, we've also noted that for some people, the side effects change. There has been some note of elevated creatinine levels that in some cases leads to chronic kidney disease. We can't automatically state that that's due to the Gleevec because there are a number of other factors like CT contrast, your family history, your lack of, or hydration and diet and all other things. But we have noticed that patients who are on the drug longer are more likely to have chronic kidney disease than patients who don't. So that's one that changes. But actually, most of our initial research has stated that when you first start the drug, that's when it's the hardest in terms of more acute side effects, and it tends to get better over time. We don't know how much of that, though, is just patients getting used to it, too. So that's part of why we've instituted a program like SideEQ, is to answer those questions.
Thank you. Okay, the next question. Lately, I started having long-lasting muscle fasciculations of my thighs and calves and quite a bit of cramping in my lower leg. The fasciculations seem to last for days, off and on.
Wow.
Have other people mentioned this? I've been on Gleevec for 3.5 years, and my blood chemistries have always been normal. Lori?
I have heard that from some patients on Gleevec, yes, that it can cause a variety of muscle and joint issues, and they sometimes change over time. And they can sometimes cause muscle cramping. Now, I think it's worth mentioning to your doctor or nurse, because there are other things, particularly some electrolyte imbalances, that can also cause the muscle cramping and things like that. And sometimes it can be the drug that caused the electrolyte imbalance. So it's probably worth mentioning to see if your healthcare provider wants to follow up on that and just see if that could be part of the problem. But I also, particularly with the muscle and joint problems that occur with imatinib, we've heard a variety of things, and they can change in certain patients over time. I don't know what the SideEQ database is showing.
Well, I was going to say, the other thing we would mention with that is most patients who are GIST patients are not operating in a vacuum. They have other comorbidities, we call it, other diseases. You might have diabetes, you might have other problems. So it's important to mention to your doctor, not just that you're taking imatinib, they're obviously aware of that, but anything else you're taking, including anything that's over the counter, anything that's herbal, or a natural thing, because that could also affect these things. Electrolyte imbalances could be due to sodium in the diet and things like that too. So we have to, and sodium tablets are sometimes even prescribed for things. So we have to look into that. SideEQ, when it looks at those kind of issues, we said from the very beginning, we are not looking to establish a causative relationship between a drug and an event. We can't do that because these are lifestyle studies where, like I said, people have all kinds of other issues. We are looking to establish a correlation. As a statistician, I have to say that there is an association between this event and you taking this medication. As to whether it's caused by it or not, we don't know. But we're just looking to figure that out, and then maybe with further follow-up studies, we could get into causation. But that's well beyond the scope of this. It's more of a system to alert us to potential issues and to help you manage them.
Okay, just one more question. This individual says they have some reported lower ANC and risk of infection. Kindly appreciate any recommendations to manage that.
Well, it's probably your treatment that's causing that. And so there isn't anything necessarily that you can do to raise your ANC. I mean, your doctor will probably keep track of that, and sometimes they will decide to adjust doses. But beyond that, so you're going to be more prone to infection, so you've got to do the things then that are going to keep you from getting infections. So hand washing, good hand washing is absolutely number one, the best thing to do. Wash your hands frequently. Avoid touching your face, your nose, your mouth, your eyes with your hands unless you've just washed them, because that's often how you can pick up germs and then get them into your body. And then you want to avoid people who've got infections. So people with colds, people who aren't feeling well, avoid them, avoid crowds where there would be people that you don't know whether they're feeling well or not, and you could be susceptible to infections there. So those are the kinds of things that you're going to want to be careful for. You're going to want to watch for things like developing a fever or chills. And again, check with your healthcare providers to find out if you start to develop a fever, when do they want to be called and notified that you have a fever. But there really isn't anything you can do to make your ANC go up. So you just have to protect yourself.
Excellent. Okay, I want to thank our panel. Oh,
go ahead.
Sorry, if you have to go out in a crowd, wearing a mask, one of just those paper masks, actually does give you some protection. So, if you have to go out in a crowd, you might consider, getting some of those paper masks and wearing those too when your ANC is low.
Great. Thank you very much.